This is new material, new updated from things that many of you have given input on or have used in the past. So you're seeing the first time we're sharing widely some new core functions of implementation informed by lots of input from all of you over the last couple of years. And I will talk through these, and then we'll have time to go out into breakout rooms again and talk about some of the ways that you're implementing strengthening families at whatever level you're implementing it. So just a reminder, when we talk about strengthening families, we really mean two distinct things. There's the approach, the core values that Cailin presented about at the beginning of her presentation earlier today. These are core values that should guide service delivery and program practice, designed to help families build their protective factors. And then it's the framework of the protective factors, which you all know and love. So when we look at this approach and the protective factors framework, there's still this sort of missing piece of, well, what do we actually do? How do we actually make this happen in our communities? And we have this set of core functions of strengthening families implementation. This, as I said, is newly revised. This is the first time we're sharing this new version, and I believe Jenna is putting an attachment in the chat that you can download to read more about these, but I'm just going to talk about them each briefly now. These core functions are things that you can be carrying out whether you are a direct service provider and thinking about how you can do some of these things in your work, or if you're leading the strengthening families efforts for your state or for your organization. Whatever level you're at, these core functions should be relevant. The first one is very much related to the fantastic panel we just heard, is about partnering and sharing power with parents to shape plans, build strengths, and reach other parents. And actually, rather than talk through all of them, I'm going to go to my slides that go one by one to make sure that we cover a little bit of content about each of them. So as you just heard from our great panel, this idea of partnering with parents, and as Cailin said earlier today, not just having parents at the table, but really shifting power to parents is critical to implementing strengthening families. So we're talking about supporting parents in making decisions for their own children and families and lifting them up, supporting them in that, recognizing the good decisions they're making and the leadership they're exhibiting there. And then from that basis of respect and relationship, inviting them to help shape programs and services and inviting them to help influence policies. When we're partnering and sharing power with parents in these ways, they're not only building their own protective factors, as we heard from the parents on the panel today, but they're the best way to reach other parents. They're the best way to make sure that our plans actually are going to work for the communities we're trying to reach and for families like theirs. And so having those voices at the table and giving them, the parameters and letting them run with it, those are great ways to have effective programming and especially effective outreach to other parents. The second core function is about providing leadership to encourage effective implementation of strengthening families. And this, again, happens at all these different levels, that you could be providing leadership within your agency to say, we're going to get a group of folks together to do the self-assessment and to start implementing some things. Or it could be at a state level saying, we need to call a meeting of all these different systems that touch the lives of children and families. Whatever level you're at, there needs to be some leadership to make sure that there are resources going towards strengthening families, that you're coordinating your efforts. So we don't have, somebody bringing in a trainer for one group, and then the next week somebody's bringing in a different trainer for another group, when you could actually combine resources and have folks experience that together and save some money just doing the training one time. So thinking about things like that, where you're providing leadership that allows for coordination, for greater investment in strengthening families and in making sure that the work keeps moving forward. The next core function is about training and coaching service providers and system leaders so they can shift practice. So what you see on the screen here is one way that we talk about that at CSSP, looking at the different ways you can take a protective factors approach in all these different types of interactions that we tend to have with families in different programs. But there are a lot of, as you saw earlier, many different ways of training on the protective factors, and increasingly a move towards, okay, what do we do once people are trained, right? They get it, they understand the protective factors, but how do we actually coach some shifting in practice? And some of that can happen through one-on-one coaching, observation, and feedback. It can happen just through, I saw Janelle in the comments earlier said, I feel a Strengthening Families 202 coming on. Like we need to have the next level training for helping people take this more broadly in their communities, but also for implementing in practice. Once you've got that base level understanding, what comes next. And so really looking at how you shift practice, that day-to-day, everyday action level of doing your work differently. How do we make sure that people actually have some support to implement that? The fourth core function is implement policy and system changes to better support families. And so we've actually separated this out. Those of you who were familiar with the previous core functions of implementation, practice change and policy and system change were all bundled together. So we've pulled those apart a little bit now because it is different. When we're implementing policy and system changes, in some cases, that's like advocating for capital P policy change. We are talking to legislators about big P, little p policy, but it's all about the funding, what concrete supports are getting to families, what rules and regulations affect how we do our work or how other people do their work that interacts with families, and what are the protocols and procedures that are happening in that day-to-day work so that that practice shift can actually take hold all across a system or within a whole agency. The fifth core function is very close to a lot of what Charlene was talking about earlier in terms of that broader understanding of the influences on protective factors. So it is about promoting community conditions that strengthen families. And the image on your screen refers to a project that we did with several partners. Some of you are on the call today. A few years ago, really looking at what community conditions make child abuse and neglect less likely, make optimal child development more likely, support families to thrive. And it came down to what we found based on the research and what many of you responded to a survey about. These 4 items that are arranged the way they are very intentionally. So around the outside corners, we have essential and basic needs. Are people able to meet their needs? That's really critical, and community conditions matter a lot for that in terms of who has access and how easily they can get those needs met. Then we have social support and connection. We've been talking all day about how important that is for people to be able to find social connections, to ask for help from their social network. And closely related to that, on the other corner of this pyramid, is the social contract. So this understanding that parenting is hard, that we're all in this together, that it's okay to ask for help, and other people will hold you up when you're struggling because all of us care about all the children in our community. And then at the heart of it all, in the center of this pyramid, you see racial and social justice, because there is not a community in America where everyone has equal access to these other 3 pieces of the pyramid. And we need to be doing intentional work to make sure that across racial and other demographic lines, across zip codes and railroad tracks and whatever else divides our communities, that everyone has access to these community conditions to better serve the families you do serve, to think about who's not being served and how maybe your services could reach populations you don't currently reach. But then of course, working at an agency or state or community level, you can be advocating and changing things for all of these community conditions on a larger scale. We also have this image, and I think Nilofer's probably smiling right now because this is a slide she created a long time ago. But when we address those community conditions and we have a community that's really infused with family support, what does that look like? So you see this sort of spectrum of light touch family support and the settings that families are in every day. And then connections and support from dedicated family support resources. So there is a family resource center, and somebody at the library knows about that and can refer people to it. So that connection, like places families go every day, the laundromat, the grocery store, within those dedicated family support type of programs and services, there are connections to more intensive services for those families who need them. And there are navigation supports to help families make the connections, especially when they're navigating multiple systems and different needs for different family members. Families need help just figuring out how to make that all work together. So what you see in the arrow across the bottom is a common language and commitment to helping families build protective factors. And in addition, we need to see policies and community conditions that strengthen families, that build up these pieces of a family support system, but also just make it easier for families to live in that community and to support their children. Okay, our sixth core function is evaluate effectiveness and engage in regular reflection to improve the work. And so that is both sort of the formal ways of evaluating effectiveness, using the program self-assessment, using parent surveys, whether that's the parent's assessment of protective factors or the protective factors survey. Those are both validated tools for measuring parents' protective factors by self-report and measuring change over time. And then more generally, just having a quality improvement approach to your work. The plan, do, study, act cycle is there on the screen. Whatever that looks like, whether it's formal or informal, taking the time to reflect on what have we done, what's actually changed as a result of it, how well are we doing what we set out to do, and what can we do better.